Right now, the snowstorm that has blanketed the high country and the Denver metro area is making for quite a tough drive. We're looking at a live camera from Idaho Springs, where the roads are slick right now. So if you have somewhere to go today, make sure you give yourself plenty of extra time.
It's pretty if you can stay in and
beautiful.
enjoy looking at it. Well, numbers just out from the state's health department yesterday show we are on track to hit a record number of pertussis or whooping cough cases this year.
As of December 8th, 1,047 cases of whooping cough or pertussis were reported in our state, along with one death. And this is the first death from whooping cough since 2005, when there were 2 deaths. We're talking about this situation with Dr. Dianne McCallister, who is Chief Medical Officer at Centura's Porter Adventist Hospital. She joins us every Wednesday to understand more about this disease today and why it's so important to be immunized against it. So let's begin with the basics. Dr. Dianne, what is pertussis, whooping cough, and what are the symptoms of this disease?
Pertussis is a disease that often starts out with a cold-like symptoms, so a mild cough, a mild fever, but over the course of about a week, the disease increases in intensity, and people start having spasms of coughing that are very intense, and in fact, they usually end with a big whoop as they try to get their breath back after coughing. Now, in these days, we don't take pertussis that seriously, probably because we don't see it that often, but in the last century, whooping cough was one of the major causes of death in children, particularly infants and very young children, out of all the reasons for death. So It's a very devastating disease.
What makes whooping cough fatal?
So the thing that makes whooping cough fatal is 50% of infants under the age of 6 months end up hospitalized when they get pertussis or whooping cough. Of those, 50% have periods where they don't breathe in. It's called apnea. They also can get pneumonia. 1% of them will die, and 1% will have seizures. And then there's other less common reasons for dying just from the intensity of coughing. They break ribs and get bleeding in their brains.
Oh, man.
This is so frustrating for parents. Anytime your child is ill, it's very frustrating for mom and dad. But there are things that we can do, I would imagine. Or is it just a wring your hands kind of situation?
Well, you know, the good news is this is a completely preventable disease if we get vaccinated.
So you have to take steps
vaccinations
in advance of the disease.
Right, in advance. And, you know, there are parents who worried, there's word out on the street that there's a connection between vaccines and autism.
Yes.
I want to make it very clear that the article that this was all based on was, in a very unusual move, retracted from the British Medical Journal because the author admitted that his scientific processes were false and misleading. So it was completely false data that all this concern comes from.
So you're saying there is no connection between vaccines and autism?
None that have been scientifically proven.
And that being said, who should get vaccinated? This is not just a vaccine for children.
Right, and that's really important news. So your pediatrician can tell you when your infants should get vaccinated, but those of us who take care of children, either as healthcare workers, as parents, as grandparents, aunts and uncles, or daycare workers, should all be revaccinated for pertussis because our immunity to it declines over time.
Something to think about for all of the parents out there.
And
Thank you so
easy
much.
to do.
All right. We'll take your advice, Dr. Dianne.
Thanks.
Thanks again for coming in. And as always, we'll be posting today's segment on thedenverchannel.com. Just scroll down to the homepage or until you find that red TV button that's on the right-hand side.